And today with me on this call also are Andrea Schindelbauer and Morgan Patterson. First, I'm going to walk you all through what the loss control team is doing out in the field as far as PPE and how we're interacting with people. Then I'm going to talk to you about some of the common concerns or issues I see, mistakes people walking out of retail stores. And if you have any questions during this, hit the raise your hand button, or you can also chat. And if you have a question for any of us, and actually I see Courtney instead of Morgan, so it looks like Courtney is filling in for Morgan today, or I had the wrong people, which is probably the case. But anyway, I wanted to tell you our team has been back on the road for the last 2 weeks. We started out doing small stuff, seeing all the skate parks that we insure, plus going to our insureds that have like 0 to 3 employees, but still have parks that we need to walk through. So it's a perfect time for us to do that because the parks and playgrounds are closed. We have found that the skate parks aren't closed, but not that many people are using the skate parks anymore, so it hasn't been a big concern. But our routine is I was able to get hand sanitizer, nitrile gloves, and face masks for all of our employees about a month ago. They have plenty. They're going to start, we've already started moving the simulators. I think we've had 4 simulator moves already, so I was just checking, in the last 2 weeks, we've done 60 on-site visits, which we normally do about 120 a month, and somewhere between 12 and 1,400 a year between our team of 7 folks. So our rules for when we come to see you all is if we're outside, we don't have to wear a face mask unless it's a large gathering of people, and we'll try to avoid that. But if we come to visit you in your offices, we will don a face mask because that is what the governor has asked us to do. And quite frankly, from an industrial hygiene standpoint, that's the right thing to do. I know that I wear my face mask every time I go in a retail store. The employees there have been asked to do it. And for me, it's not a matter of whether it's my right, it's whether it's respectful to the people that have to wear it all day. So I do, our team will be doing it because the last thing we want to do is be out in the field with a KLC shirt on, walk into a retail outlet to go to the bathroom or to shop, and somebody snap a picture, and then the governor gets it, and then the next thing, JD's office gets a call. So we're going to do it because it's the right thing to do. Not only for the people we visit, but for everyone else. I want to talk to you about some common mistakes that I see people coming out of grocery stores. You know, the CDC has come out with a new guideline that said that surface contamination is not as bad as they thought. However, surface contamination is still there. The test that they did is that they tested surface contamination for 48 hours and found out that for the most part, the surface contamination is gone after 48 hours now. Their next test will be a 24-hour test, and then they'll go down further and further. So don't misconstrue that report with the fact that surface contamination is not an issue. It still is. If you come into a gas station and pick up a pump after someone has just pumped and they have the virus, that can still be on that pump and on those screens. Same thing in the grocery stores. I put together, Aaron and I put together a little video for our team and talked about some of the issues that we see people coming out of retail stores. And the biggest thing is, as soon as they come out of the retail store, the first thing they do is grab their sunglasses, and pull them right down on their face, and look where their hands are, right next to their eyes, which is one of the areas that this disease can go in. So what I tell everybody is don't wear your sunglasses in a retail outlet, keep them in your vehicle, and wait till you get back in your vehicle and you've actually sanitized your hands. I do that even before I close the car door, because that's one less thing that I have to sanitize if I get in. What I see is usually people walk out of the store, the first thing they do is jerk their face mask off, which now they've contaminated their face mask because they've touched it. Possibly if they've picked up any of the virus in a retail store at the cash registers or anything they pick up that someone else just picked up. So, you know, when you get in, before you push buttons, check your cell phone, adjust your visor, do any of that, sanitize your hands. It's just basic common sense. So but people, you know, make mistakes. I've caught myself doing it, and I'm now much better. I do not wear my sunglasses in, even on a really bright sunny day. So just trying to do everything you can to reduce that surface contamination and keep you healthy. I'll open it up. Andrea and Courtney, do you all have anything, or do we want to go to question and answer? Or?
I'm good. We just want to go to question and answer. I don't see any yet. So if anybody wants to post a question, either in the Q&A or chat. Courtney, do you want to talk about reopening?
Sure, I can. While we're waiting for those questions, because we do want to hear from you guys, I actually just got the proofed copy back. So hopefully this afternoon I'll get these proofing changes made, and we'll get these on our website as soon as possible. We did come up with some general guidelines from an employment perspective as far as safety and guidelines and helping ensure safety in the workplace. The guidelines, the sample that we will have available really is modeled after the Healthy at Work provisions and after the provisions adopted by KLC, which again goes along with the Kentucky Healthy at Work guidelines. Cities are not required to adopt verbatim the Healthy at Work guidelines like some businesses in the private sector are, but they still are kind of a good place to start. One of the main things that I think I would recommend for cities to consider is making sure that you're appointing a Healthy at Work officer, appointing someone and designating someone to oversee and make sure that your employees are remaining safe. So I think that's a huge piece for cities to do, even though you aren't required to do so. Choosing to elect to have one point person, and maybe that be somebody, if you don't have a risk manager, who is it that typically works with your loss control person from KLC? Who's that individual that is familiar with those processes and can be involved in the safety piece of it? So I can get into some more specifics if we have more questions, but I do want to kind of kick it to our members and see if we have anything yet. Not yet.
One thing I'll cover while we're waiting on hopefully some people to ask some questions is I got a call from a member last week, and they were talking about opening their summer camp, but just for the employees of the city. And so I talked to that person and I said, now understand that currently there is no liability coverage for anything associated with viruses. So let's assume in the summer camp that you have 40 kids there, 20 of them come down sick. One of those kids takes that virus to a neighbor kid who gives it to their parent, whose parent passes away. There are a ton of plaintiffs' attorneys out there right now, we know, waiting to file lawsuits. The city would have no coverage and no defense in this case because no commercial general liability policy covers viruses at all. So if you're talking about opening something back up where you could easily trace this virus back to that group of people, I would encourage you to rethink that. You know, playgrounds, not a huge issue. Swimming pools, it's going to be very hard to trace that back. But in the case in a day camp where, you know, if a bunch of those campers come down with that virus, then it could possibly be traced back to that day camp. Businesses all over the country, no businesses have coverage for the coronavirus under their property or liability policies. It's an excluded event, and as actually the reinsurers are making everyone firm up their policy language to where it even includes COVID-19 for future events. So wanted everybody to be aware that that's an issue that's popped back up. And if you have any questions or concerns, we can answer those. I see we've got a couple of questions.
Mm-hmm.
Brian, what are suggestions on reopening skate parks? There again, that's, I think, skate parks aren't typically a big issue. You know, 7 or 8 years ago, skate parks were, but the majority of them aren't used like they were recently. You know, I visited in the past 2 weeks 6 skate parks and talked to the Parks and Rec folks. And in 4 of those parks, they said if they see 7 skaters a year, they're lucky, because the big craze is kind of over. Now they are coming out with a new Tony Hawk skate park video game this year, and they assume that there may be an increase from that. But overall, the skate parks that were built in the last 10 years, the traffic that we're seeing in most of them is way down. So, you know, if it gets to where there's 50 or 60 people and that's outside of the norm or what the governor has said is allowable, then you probably need to look at shutting it down until the governor gives the all clear. And I'm sure our legal staff could chime in on that.
Yeah, at this point, we're looking at no more than groups of 10. So yeah, definitely if we had large groups like that, that would need to be addressed.
Yeah, and there again, in the bigger skate parks like in Louisville and Bowling Green, you know, you could probably put 10 people in that skate park and they wouldn't be any closer than, you know, 40 feet away from each other. But the smaller skate parks, yes, that would be a concern. We took another call. I took a call from a resident today, ready to get his pitchfork and ride over the public pool. What would your 30-second reply be? I tried, he didn't want to hear the reason. In case I'm missing something obvious, what you all say. So here's what I am telling my people that call and ask, what about the swimming pool? And first thing you have to look at is budgets. Everybody's budgets are tighter. There's not a swimming pool I know in the state of Kentucky that makes money. They all lose money. So why would you want to open it back up to the public when, one, you may not be able to get lifeguards because the governor's talking about the middle of July before he's going to allow those to be opened up. And then 2, it's going to cost you a lot of money to have it open for a month and a half. And there again, you know, let's say 100 people show up and 40 people at that pool all get COVID-19. Somebody passes it to somebody else who dies. I mean, it's a stretch in a public pool, but there again, there's no liability coverage for it. You know, I wish I could tell you something different, but there's just not. And if you get sued, there's no defense coverage and there's no liability coverage. So personally, I think from an economic standpoint, it's not a good idea. And from a liability standpoint, I don't think it's a good idea to reopen the pools this year. That's just one person's opinion at KLC. That's not the entire opinion of the Kentucky League of Cities.
Yeah, and right now, I mean, we can't, based on the governor's order. So until that's lifted, it doesn't matter what our opinion is. We have to follow those restrictions. So we'll have to wait for guidance from the governor on that.
Let's see.
One other thing while we're waiting for some additional questions, which maybe we're getting some, I just wanted a couple of notes. One note is that participants there is a feature where you can raise your hand. So I'll be looking at that window. And if you have something to say, I'm being told by Soraya, who is our wonderful tech person behind the scenes, that you can do the raise your hand, and then when we call on you, you can use your mic if you have a mic available to be able to speak. So you don't have to do just the Q&A. And then the other thing I wanted to note for those who are considering options like what Brian mentioned, where you're offering a day camp, but you're only offering it for city employees. I just want to put a plug for ethics issues that revolve around that, is that you cannot provide benefits to your city employees that are not generally acceptable by the public. So any kind of plan to open something for city employees only, you'd want to be very careful in doing that and talk to your city attorney before doing that, because you don't want to run into a situation where you're offering something just for city employees that might rub up against any ethics issues. Not saying that that would have been in that particular instance, but it's definitely something where you'd want to talk to your city attorney first.
Got another question here. It says, I thought I heard the governor say yesterday that all employees should take a COVID-19 test and confirm that it's negative before they are allowed to transition back into the workplace. Is this a requirement now? I have not heard that. Ladies, have you all heard that?
No, I think it's more the CDC is recommending that employers do that, and I would be a little leery of doing that just because, you know, it's not a guarantee that somebody isn't going to get it. It doesn't mean they're safe for the next month or so. So I'm a little leery of it. If you have an employee that's been off sick, maybe with COVID-related symptoms, before they come back to work, it may be a good idea to have them tested so that it comes back negative. It may be more of a comfort for those employees that they're going to be coming in contact with.
Yeah, I know that not even all the medical facilities have tested all their staff. So I think it would be hard for a city or any other employer to test all their staff prior to coming back. Should we require employees to wear masks and gloves if they are dealing with the public? There again, I'll tell you what my team is going to do, and I told you what my team is going to do. I know that when we have visitors in our building, we are asking that they follow our rules, and that is when we're outside of our office and in common areas, we will be wearing face masks. Also in the meeting rooms, we will be wearing face masks, and any of our visitors that come to the office, if they don't have a face mask and they're going to be in a common area or they are in a meeting with us, we will supply them with a face mask to wear that at that time. Outdoors, I don't think you really need to, unless you just have those people that don't know how to keep out of people's space. And I've seen a few of those, especially at Walmart or some of the retail stores. Some people just don't, they think 6 feet is 6 inches, I think. So there again, I don't think there's a legal requirement, but that's just what we're going to do.
And again, you know, CDC and the governor is recommending that everyone wear masks when in public and maintain that 6 feet social distancing. But the one thing you have to keep in mind as an employer is that there may be a medical reason that someone can't wear a mask. So if someone comes to you and says, I can't wear a mask because it will trigger my asthma or whatever it may be, and if they have a doctor's confirmation, you need to make an ADA exception for them. And it may be tough for them to get a medical doctor's note right now, so be patient with that. Just take them at their word for now, if you have to.
And the other piece of that too is if they are saying that they cannot wear a mask, you know, it's also completely reasonable to then make some adjustments in their workspace. So if they can't wear a mask, but there's the ability to socially distance them and get them away, get them in an office, that sort of thing, have them come in at a time where no one else would be coming in or out of the door. Some of those things to help minimize contact between that employee and others. And I know that the question was about an employee, but since we're talking about the mask, I think it's important to note that if you have, I think it's fine for a city to require loosely require members of the public coming into City Hall once it's open to wear a mask. But if someone says that they have a medical reason that they cannot, I think the best way to approach that is to take them at their word, and just again have processes in place where they remain 6 feet away from the employees when they're interacting.
The next question is, when will the next group size of congregating change and what will the numbers increase to? I know that the governor is really looking hard at that 14 days of decreasing cases. So I'm going to assume that's going to be the next time they look at changing the size, but as far as the number, I have no clue. I haven't heard what the next group size is going to be.
I think the goal is July 1st for 50 or more. Is that
June 29th.
Is it June 29th?
Yeah.
Okay.
29.
But that again, I think it is dependent on how the numbers are. So that's the goal, but that's not a guarantee.
Yeah.
For a park in the middle of June for light sports, should the restrooms be opened? I don't know how to answer that. From a personal standpoint, I would want them to be open. But there again, you know, you're going to have signs up like the retail stores do where, you know, it's limited to 2 people in the restroom at one time, or depending on how small the restroom is, 1 person at a time. And you'll have to post that signage. But personally, I think it's a good idea. I know the state parks and the federal parks have opened their restrooms back up at like marinas and boat launches and parks. So there again, you just have to kind of follow what the retail folks are doing and post those signs on how many people are available in there. Now, you will need to clean them several times a day if you're going to open them. So make sure you have the resources to clean and sanitize those several times a day. Are any cities beginning to do, Are any cities beginning to do public city council meetings that they can keep the number of individuals within the 10-person limit? Ladies, you all want to answer that? I haven't heard.
I'll take it. They are, if you're able to, this is a complicated question. There are cities that if you're able to keep it within the 10-person limit that are beginning to have city council meetings. However, part of the rub here is that you still have to have public access to the meetings. So yes, your city council and the people that must attend that are with the city, you may be able to keep that under the 10-person limit, but then you're not able to have the public in the room. And I think that can become problematic. There are some cities that, as I'm aware, are having like members of city council, the mayor, city clerk in the room, socially distanced, at least 6 feet apart, but captured on video and broadcast still, so that the public could attend virtually through the link, like the cities have done prior to when everything had to be virtual. So yes, it's happening. I think the better option is to continue to have it virtually. I think it's very rare that we're seeing cities that truly can capture on video all of the attendees while they are also maintaining the 6 feet of distance. I think there's few and far between of the facilities that can do that. I think the best option is to continue to hold them virtually as much as possible. Do you have anything else, Andrea?
I was just going to say that, especially if you have members of your council or commission that are in a category over the age of 60, or maybe they have underlying conditions, you want to be very aware of that and make accommodations for them. So, and you know, best practice again would be to not have them in person at this time.
The next question is, you mentioned playground equipment. Are we able to open that equipment? What are the qualifications for sanitizing the equipment? Also, would the same be true for outside exercise equipment? We are considering opening our tennis courts since individuals are separated and bring their own rackets and tennis balls. We're keeping our basketball courts and picnic shelters closed at this time. Thoughts? That's a good question. I know in Florida, they have opened back up playgrounds because we have some young friends that take their children to the playgrounds. They do not have anyone sanitizing that equipment. They're relying on sunshine and rain to sanitize the equipment, and have posted signs in their parks that parents bringing their children should make sure they wash their hands, sanitize their hands very well after leaving the playground. There again, I'm not sure what the governor's stance is. I haven't heard whether parks and playgrounds are allowed to be back open yet. Ladies, any?
I don't think it's been directly addressed. I think they can be opened. I think that's a call to make. I don't think that there's any additional liability. I know this has come up before, and I don't know the statute offhand like Chris and Morgan do, but as long as they're provided for free, it still falls within that recreational use. So they're using it at their own risk. So I think it's possible. It's just whether or not will it encourage congregation of groups? Is it something that's worth the risk? That's a call to make. And I just received a text, which is probably the statute. It's KRS 411-190. So under that, you're not going to have any additional liability for having that equipment as long as it's free. Those playground equipment, that sort of thing. So it's definitely a call for the city to make.
Yeah, and I think you probably ought to look at that June 29th date when the governor may be allowing more people, because I think you're easily going to get more than 10 kids on a piece of playground equipment if it opens back up before then. So hopefully once that June 29th call comes and they see the declining numbers, then once they bump that up to 25 or 50 or whatever they're going to do, then I think you can easily open those back up at that time.
I have an attendee who has raised their hand, so let's see if this will work. It's Tessie Cecil. I think if you have a microphone and you unmute yourself, we should be able to hear you.
Actually, it looks like Tessie's using an old Zoom. She won't be able to. She'd have to just upgrade to the Zoom 5.0.
Okay, so apparently that's not going to work. So Tessie, if you can insert your question in the box and we will get to it. Sorry about that.
One of the questions, any words of wisdom for inspiring city management department heads who adopt the policies but don't model any cautionary behavior when inside the building out of public view? Crowded lunch together, close talkers in halls, etc. There again, if you don't feel comfortable, you always have the right to ask someone to back up and be at least 6 feet away. We have, for the reopening of our offices, we have shut down the break rooms and the lunch rooms, and people won't be allowed to congregate in those rooms. So, that takes some of that exposure away. But I can tell you that I have visited some cities where no one in City Hall is wearing a face mask. They were at least 6 feet away, but that was their decision. There again, all I can tell you is what the CDC and the governor recommends for your health and everyone else's health is that you follow those guidelines. But the same holds true for retail stores. I went to Cabela's on Monday and was appalled by the number of people in Cabela's that did not have a face mask on, probably 75% of those people. And I chose to turn around and go back out the door. So that's a tough one.
Yeah, I think if you have policies in place and your department heads aren't following them, I would take that higher up the chain. So if you're mayor council, take it to your mayor, your commission form, take it to your commissioners, your city manager, city administrator, because those policies are in place for a reason. And if they don't follow the policy, there should be disciplinary action.
And I think it's helpful to have that healthy at work officer there, so that, and making it clear in your policy that if someone has concerns, that they can take those to that healthy at work officer, so that they can help facilitate the conversations that need to happen around that.
Next question is, what recommendations are being given concerning 4th of July fireworks? I haven't had that one come up yet. Ladies, have you had that one come up yet?
I think most cities kind of have it on hold if they haven't canceled it already. I think it's going to be really tough, because even if June 29th we open it up to 50 or more, I mean, that's going to be tough.
Yeah. I mean, to get people to social distance.
Yeah.
When they're sitting around in parks and stuff is going to be tough to do. You know, unfortunately, a lot of our cities have already purchased those fireworks for this year. So there again,
The other thing too,
yeah.
I'm sorry.
Go ahead.
The other thing too to consider is when you're considering whether or not to have July 4th parties or some of these other things, is to have conversations with your local health department. You're not required to by any means, but I think the direction from the governor's office has been that enforcement should flow through the health department, which is good because that takes it off of our law enforcement rights, but that's a good thing. So if they're going to be the ones enforcing it, it's helpful to know where they stand on certain issues and what they consider okay and not okay, and getting some insight on what they think. Because I think it is going to be community dependent and city dependent. I think there are some cities that may be able to very feasibly have a very open field available to do fireworks, that everybody could remain in their cars and that's okay, and it can happen. In other communities, it's just not possible. So I think it is, if you have not had conversations with your local health department, I think it's helpful to consider that as part of the formula for those kinds of public events.
This one says elected officials are eager to get back in the city hall for meeting because they think that is more transparent. They have more watching Zoom stream. They don't seem to get that the body plus CAO plus attorney plus clerk equals 10. Is there a polite way to point out that, or can we quote KLC on that?
You can absolutely ask them to contact us if you need that backup. We're happy to do it. And again, if any one of the attendees or the required attendees has an underlying condition, you have to make an accommodation for that. So if that's a concern outside of the fact that it's still a small room with 10 people, definitely point that out. But we're more than happy to talk to anybody about other options.
I think honestly, from a transparency perspective, there was a recent article on a couple of local governments that did it the right way. Now they were having in-person meetings and there was a technical issue, the feed stopped. And I guess since it's a positive thing, we can say it was Scott County and the city of Georgetown. And the newspaper was watching live and got worried that, oh, the technical issues mean that they're actually going to continue meeting. So the newspaper ran over there and found out that they weren't continuing to meet and that they had stopped and they had suspended. So that's a positive. You usually don't see the good things reported in the paper, but I think there's actually, to me, I think there's more, I would maybe have that conversation and pose it the opposite, that if you're meeting in a room that no public member can come to unless they're attending live, there might be more of a perception that they could be hiding something. Whereas if everybody is attending virtually and there's a technical issue, then those side conversations cannot continue. So that's maybe another way to kind of flip that if you're having that conversation.
Next question, has there been any indication as to when the suspension of gaming licenses will be lifted? I know this brings a large number of issues along with it, but we have a number of small facilities that continue to ask for guidance. Ladies, any clue?
Out of my realm.
Me too.
Yeah, I think that's going to go back to, June 29th
And maybe contact Fish and Wildlife, see what they say.
well, gaming licenses are meaning by gambling. So
Oh,
like bingo
gambling.
bingo,
Not animals.
Yeah.
Animals is where I went to. So clearly this is not our area.
I'm pretty sure they were talking about gaming as in
You're right. I'm sure you are.
and bingo parlors. And bingo halls are the ones that are really asking the most questions, I think. And you just can't reopen until the governor says you can. Are we required to provide PPE to our employees, and are they required to wear the PPE? OSHA says that you have to provide PPE to your employees based on a hazard assessment of each individual job. So if your folks are working outside, mowing yards or mowing grass, working in parks, they probably do not have to wear gloves and masks. If they are picking up trash, they should be wearing gloves and masks and should be taught how to take those off properly. You know, there again, if you go back to the one city that asked about the day camp for employees' kids, all of those people should be wearing PPE as far as the camp counselors. So there again, you have to look to the OSHA guidance and what the hazard assessment would be for each individual job and decide at that point whether you needed to purchase nitrile gloves and face mask for that individual job.
Generally, I will say, as far as OSHA requirements, generally OSHA recognizes that there is a shortfall of PPE in the supply chain. And so that is why the governor's orders, which, let me clarify, there is no requirement on the city to provide it in the same way as it is other private businesses. But any language that does require it, it says to the greatest extent practicable. I think that's generally the phrase that's used. So document that you're making efforts to obtain it, where you are trying to obtain it, show that the supply is not there. If that's the reason you're not able to supply it, just keep that documentation available.
Next question, when can softball leagues start up? There again, you go back to what your health department can tell you, and your health department is going to base everything off of what the governor can tell you. I think probably what you'll have is softball leagues opening up with no fans. And then, you know, only if the fans are at least 6 feet apart can they do that. So.
And I can tell you what I have read, and also because my grandson plays baseball, and they're planning to start back up June 15th. And I think that's the governor's guidelines, but of course it's still dependent on where we are at that point, but that's kind of what we're pushing for. And I know that what our league is saying, of course, there's gonna be a lot of social distancing. It's gonna be completely different than what we normally have. And they are gonna be limited to 50 spectators. I think our ballpark is going to try to show them online so that those who are maybe compromised by COVID can watch it online and not come to the game. So grandparents are probably going to be discouraged from coming to the game, but since I'm team mom, I get to come. So that's kind of where we are. We're just going to have to wait and see when it gets closer to those dates.
I think you're muted, Brian. I can go ahead and read the next question while he's working out the glitches. I wear my mask for limited trips into the office out of respect and to prevent unknown spread to others. I'm already tired of the quote unquote joking around my paranoia, wondering if we're going to see more hostility in the workplace going forward. thoughts. So one, I want to say I'm sorry that you're having that situation. It's a bummer, as I like to say with my toddler. I think there's a possibility that some hostility is going to continue. I'm starting to avoid social media because of so much divisiveness that I'm seeing. So I think that's possible, but I think that comes down to a management issue, a disciplinary issue. Hostility of any kind should not be tolerated, whether it's this or anything. And so again, this goes back to my main recommendation, is having that healthy at work officer in charge of making sure that rules are being followed, that complaints can be heard, that issues can be addressed, that the appropriate supervisors can be brought in to, address and discipline those issues.
And I was able to turn my mute off. For some reason, when I had the Q&A box up, I couldn't turn my microphone back on, so I had to turn it off. So apparently someone didn't want me to answer that question. Let's see. What's the current conventional wisdom on fire EMS who transported a patient and had an exposure? Should that employee be off for 14 days? Are we now at a point where they self-monitor, have temperatures taken before entering the building? Ladies, you want to?
Take that one.
Yeah.
So our general consensus is still on the conservative side. If you've had a known exposure, which is close contact within that 6 feet for 25 to 30 minutes or more, which when you're transporting a patient, more than likely you've had close contact, that you would be off for 14 days. Now that said, the CDC has issued guidelines for asymptomatic employees in critical infrastructure positions, which are almost all of our city workers, but definitely law enforcement, first responders. And they can continue to work while they're asymptomatic, as long as they're following certain guidelines. So we thank you, Andrea, for providing some information. Actually, that's not that link.
Yeah, this is for the next question, sorry.
We will follow up after this to send out the link to the critical infrastructure guidelines, and it will be part of our sample policy. That link will be in there as well. Some of the provisions, if you're going to follow the guidelines to allow someone who's been exposed but is asymptomatic, they have to wear a mask, and you can require that. And if they have a medical condition where they can't wear a mask, then I think the reasonable accommodation at that point is to have them be home. You're increasing disinfection of their workstations more frequently, at least daily, if not a couple times a day. And they're doing the self-screenings, or you're taking their temperatures depending on how your city is handling it. I think most cities are adopting guidelines for the majority of your employees that would match up with the CDC critical infrastructure guidelines. So I think it's possible to maybe have someone who's asymptomatic come in, but I still think if you have a true known exposure, our recommendation is still to have them off for 14 days if feasible.
Andrea, since you already answered the next one, you want to read the question?
Sure. Let's see. Several people I see don't know how to properly wear a mask. Can you direct me to a flyer or directions I can use or post? And in the chat box, I put in the CDC guidelines on how to wear a mask, and there's also a specific poster that you can hang, and that's probably a good idea to go ahead and have that hanging for your employees to see. And you have your healthy at work person, your healthy at work officer, go over the requirements for that. At least make sure everyone gets it.
The next comment, your local emergency management office received a large inventory for each county. We just received 50 masks and also have an option to gain sanitizer. Just want to say thank you for holding this session, as well as KLC. This is good information for us all to have and know. The more we can all share with each other, the thanks to all participating for what you do and for the concerns you have regarding the local government. We are holding electronic meetings, and we're the first in our county to do so. We're looking at going back live in July, possibly after June 29th date given by the governor. Again, thank you for everything you've done. Next question. Kentucky Recreation and Park Society Task Force has come up with some guidelines for all parks and recreation departments in the state. That's good to know. I did not know that Terry had done that. So that's awesome. Thanks, Marlon. And I think that's it for right now. Do we have any other questions that I've missed, Andrea?
I don't see any.
Anybody else want to ask anything?
I will share. It looks like the executive director for Kentucky Recreation Park Society, someone has shared the email to be able to get those guidelines. So it is now in the chat box. Thank you, Andrea, for copying and pasting instead of me reading it out.
I tried to copy, it wouldn't copy and paste first, so I don't know what's going on.
That's good. I'm glad y'all can do that. I'm doing this on an iPad, so it's not the most user-friendly thing in the world. So should we give them a couple more minutes to ask a question? Do you all have any other comments, ladies? Anything that they haven't covered that you want to cover?
I'm not sure that there's anything else that I can think of. Do you have anything else, Andrea?
I don't. JD Cheney just sent me a text, said that KLC supported the recommendations and transmitted it to the governor for them, talking about Parks and Rec.
Okay, great. All right, if there's no other questions, we'll say thank you very much for attending today. We appreciate the support, and remember, we're always here to help our members. Have a great day, be safe, and be healthy. Thank you all.
Thank you.
Oh, hold on. We got a question.
Oh.
We're not done yet. Almost hung up on you. So fire department, EMS in full PPE with exposure, no need to quarantine unless symptoms develop. Courtney?
If you're adopting the CDC guidelines for critical infrastructure employees and following those guidelines, then they would not have to. It is not our recommendation generally. We still think if you have and the question has exposure in quotation marks, so it's really important to look at the CDC definition for exposure. The general community guidelines, if you look up CDC general community spread guidelines, that's what we continue to recommend as long as it continues to be feasible for the city, which is a known exposure of close contact within 6 feet for 25 to 30 minutes with someone who is known to have or is experiencing symptoms. If you fall into that category, our recommendation is the 14 days. However, the CDC critical infrastructure guidelines, which Andrea did include the link in the chat box, and we are going to send that out after this webinar. There's a slightly different definition for exposure, leaves it a little less, it broadens it a little bit, so a potential or known exposure. As long as you're asymptomatic, you can continue to work, but the city needs to adopt that policy in whole and apply it to every situation. So you wouldn't want to tell one employee to continue working as long as they're asymptomatic, but send someone else home. You want to, once you start saying, yes, we're going to follow the critical infrastructure guidelines, and this is how we're going to handle exposure, that you're going to want to continue to do that and be consistent. And it may be something where you craft the policy where, maybe, and this is kind of off the cuff, which maybe I shouldn't do on the webinar, but you might say that, your first responders, your law enforcement continue to work as long as they're asymptomatic. But someone who is at home living with someone who has been exposed, that you might end up treating that differently. As long as you have clear guidelines of how you're going to apply it or not, and what they're going to have to do to be able to continue to work or not, then you're okay.
And it looks like Mary Hornick is asking, where can we acquire a scan thermometer? And I was looking on our COVID resources page on klc.org, and I thought we had it on here, but I don't see it now.
We did. Yeah, there's a supplier over in Cynthiana, Kentucky. And I'm having trouble remembering the name off the top of my head. It was on our COVID-19 page.
Yeah, I'm not seeing it.
But some of those resources go off after a while, and I don't
Right.
think you can actually get to that stuff. So what we'll do is we'll have Terry Johnson repost that supplier over in Cynthiana. They're actually building them themselves. It's an infrared thermometer. It's about a 2-week turnaround to get one, but we'll get that posted on the COVID-19 page today. They also have KN95 masks, which are the industrial equivalent of what an N95 mask is, as well as surgical masks over there as well.
Just a quick note on the N95 masks, do not require your employees to wear those unless they typically would wear them, because you do have to have a medical fit test and once you require them to do it. If you make it available and they voluntarily wear it, then that's fine. Just don't make that a requirement for them to wear it. If you provide it to them and they voluntarily wear it, you just have to provide them. There's a booklet from OSHA that you would provide them so that they have that information available, but you would not want to require it. And if you have questions about that, I can get you the appendix that you'd want to provide to them.
And here's a comment that somebody said, local health departments are being sent some from the state, talking about the thermometers to arrive any day. Call the health department for a thermometer as well. So, I think that's all the questions we have for right now. You see any other comments, Andrea or Courtney?
Anything else?
Not. And I've just asked Terry Johnson to go ahead and repost that. So I'd be watching for that today.
Yeah.
And I made a note, Mary, so I'll make sure that I get back to you.
Okay, folks, any other questions? We almost left you once, and we had a couple more pop up. So we've got 8 more minutes left in the session. We'll give you a few seconds. There again, thank you so much for attending today's session. If you have anything that you think of after that or after this, just email us and we'll be glad to get back to you ASAP.
Somebody asked, what are the dogs' names? Those have to be my dogs. That's Caesar and Hunter.
Caesar and Hunter.
They've been very quiet. I'm very pleased.
Yeah, nobody's come around the house, so
Yeah.
yeah, that's excellent.
All right.
All right, going once, going twice, gone. Ladies, I enjoyed being with you today.
Yeah. Thanks,
Thank
Brian.
you.
Thanks,
All right.
everybody.
Everybody have a great day. See ya.